Hello everyone, my name is Ashish Rahi and this is the topic about the thyroidism, and this is the hyperthyroidism when it occurs between 20 and 1000 females and is less common in men. The causes are Graves' disease, multinodular goiter, thyroiditis, and iodide induced and thyroid stimulating hormone induced. This is the function of hypothyroidism, in which this is the symptom of hypothyroidism, which depicts about the thyroid. So there is a thyroid gland, and in this video there is a function of thyroid gland which produce the hormone production, and this is the axis section of thyroid hormone relating to the thyroid gland, that is esophagus, precursor fascia, inferior thyroid artery, recurrent laryngeal nerves, trachea and strap muscle is also there, and there is a pretracheal fascia is also there, and investing fascia is also there. And this is the thyroid development, the site of origin of thyroglossal duct between floor of branchial arcs 1 and 2. And this is the thyroglossal duct, that is endodermal downgrowth of thyroid epithelium from it. Developing tissue invades hypobranchial mesenchyma, which gives capsule and septa. The site of thyroglossal is moved with the prostration of tongue, remain thyroid tissue, lingual thyroid fistula, sinuses, and pyramidal lobe. This is to sternal thyroid if volume goes too far. So this is the thyroid gland and hypothyroidism. Thank you.